Within Chapter 1, it talks about how patient-specific health information is classified in two different ways, which are clinical and administrative patient-specific health information. More interestingly, clinical and administrative patient-specific health information can be combined for hospitals to input data that would translate into reimbursements. Why is this so important? With millions of people visiting large hospitals, medical coding helps streamline the reimbursement process and reduces the workload for both the patients and the healthcare facilities. Medical coders are actual positions within the hospital that takes care of this. There are two main coding systems, which are the ICD-9-CM, which is the International Classification of Diseases, Volume 9, and the CPT, Current Procedural Terminology. The main difference between them is that ICD-9 is used to explain a patient's condition or disease in much more detail compared to CPT, but ICD-9 has many more codes compared to CPT. CPT is mainly used to describe the treatment or services and has many more resources where physicians can look up an estimated reimbursement for those treatments and services. How was the ICD formed? The ICD, which is currently being published by the World Health Organization and used for statistics and healthcare reimbursement models, was first founded by Florence Nightingale in London during the 1860s. He developed the model to ease the process of gathering hospital data. This model later evolved when a French physician read his manual, The Bertillon Classification of Causes of Death, in Chicago. Over the years, in many revisions, the English, French, and Swedish populations adopted it, and hoped that other countries such as the US would utilize the system. To this day, it is the most utilized disease classification system worldwide. ICD has had a major impact within the United States in the healthcare industry. Not only did it create a consistent language between physicians about patient symptoms and about reimbursement claims, these codes are also used on patients' health records for administrative and clinical purposes. This has been helping with getting accurate payment to physicians and speeding up the process. ICD-9 is currently what the US is using for most of its healthcare reimbursement models. These are customized versions of ICD-9 utilized by different organizations such as ICD-9-CM by CMS. For Medicare specifically, there is a specialized coding system called diagnosis-related groups where these ICD codes are grouped into segments, where Medicare would reimburse hospitals based on these segments instead of the actual cost of the patient's procedure. The newest volume of ICD, ICD-10, has increased the number of codes from 13,000 to 68,000. Because of this change, there has been a large impact on current reimbursement models. Diagnosis-related groups rely on the ICD codes, so having an increase in codes made it so new DRG methodologies have to be used to submit reimbursement claims. While reimbursement claims for Medicare won't be affected too much, reimbursement rates that are attributed to certain DRGs will be affected drastically. Other challenges that are associated with the transition are learning and workflow difficulties. There will also be impacts on revenue for the first few months due to the different calculations that are attributed to the different ICD coding system.